where I was. All right. Good morning, everyone. You're welcome to Ask the Pediatricians Live this Saturday morning. I am Dr. Gbemisola Boyede, Ask the Pediatricians Foundation founder and one of the admin. And this morning, I have the pleasure of hosting with me on this program one of our pediatricians on Ask the Pediatricians, one of our chief admin as well, founding admin, and we will be discussing this topic of pneumonia. So it's a pleasure to have with me today Dr. Olatomi Bamigboje. Dr. Bamigboje, you are welcome to Ask the Pediatricians Live. Good morning, Dr. Tommy. Welcome to ATP Live. Dr. Tommy, can you hear me? Okay, seems like Dr. Tommy is having some technical challenges, so we'll definitely bring her back and she'll be discussing with us today on Ask the Pediatricians Live. And so as we are joining, I want you to share this video, share it on your timeline, share it on your page, share it in any group that you belong to with the permission, because I believe that everyone is going to have a wonderful time learning about pneumonia. It was the World Pneumonia Day on the 12th of this during the week, and so we thought it fit that we should discuss the topic today. So you are welcome. I can see some people are already joining us. Welcome to Ask the Pediatricians Live, and please share the video. You can also drop your questions on pneumonia related issues in children. Just drop it for us in comment section, and then we'll be able to feature it. If you are on if you're in our Facebook group and you're watching on the party, you will have to click on the video. Okay, Dr. Tommy, are you with us now? Good morning.
Can you hear me?
Oh, yes, perfectly. Welcome, Dr.
Okay.
Olatomi Bamigboje to Active Pediatricians Live.
Thank you. It's a pleasure to be here.
All right, we are so excited to have you here. So Dr. Tomi is here, so kindly start the question coming. So before we start having our questions, I will just ask Dr. Tomi a few preliminary questions to set the ball rolling. So, Ma, can you tell us what is pneumonia? I mean, especially when we talk about children.
Okay. Pneumonia is an infection in one or both of the lungs. It could affect patchy segments of the lungs, or it could affect a whole segment of the lung. And that gives it different nomenclatures. So we could have what we call bronchopneumonia when it is just patchy segments that are widespread, or we could have what we call a lobar pneumonia when we have segments, all segments of the lungs affected. Now,
All right.
pneumonia, I've said, is an infection. So it could be caused by bacteria, it could be caused by viruses, it could be caused by fungal infections. And what it does is that it causes an inflammation in the air sacs of your lungs, such that, which we call the alveoli, such that there is fluid, accumulation of fluid or pus in the alveoli, which gives rise to the symptoms that we see, affecting the ability of the lungs to provide enough oxygen to supply the essential organs in the body.
Wow, that's quite loaded. Thank you. Just before I continue, if you are watching on the Facebook watch party, you really need to click on the video so that you can drop your questions so that we can say it. And for our moderators who are on the watch party, if we have questions on the watch party which we can't see, or unfortunately, you please help us to migrate the questions to the page so that we can feature it. Thank you, Dr. Tomi. Nifemi Ani is with us. Okay. Vera is with us. Okay. Thank you, everyone, for joining us. So, Dr. Tomi, the mothers, I'm sure they don't, they are not worried about all those our bigger terminology, but they want to
words,
know.
yeah.
They want to know what caused pneumonia, I mean, in the children. So I know you mentioned bacteria and all that, but mothers always ask us whether it is caused by things like cold, like maybe the child drinking cold water or the child lying on cold floor. What do you have to say about this
Okay.
information that mothers always ask us?
Well, pneumonia is not caused by drinking cold water. Like I've said in the definition, it is an infection. An infection means that there is an organism that causes this problem, which we have said could be a bacteria, fungal, or viruses. So pneumonia is not caused by drinking cold water. Pneumonia is not caused by lying on the floor. Of course, if you lie on the floor too much, you could have issues with body temperature and all that, but that is not the cause of pneumonia. Pneumonia is specifically caused by organisms, which could be different types of organisms.
Yeah. So thank you so much for for dismantling that myth, because one of the things we do on HCP is actually to correct all these myths, and especially for the newborns, we see people wrapping them up and make sure the windows are closed, no hair, nothing, because they don't want the child to catch cold or pneumonia. So you have heard from our experts this morning that it is not caused by cold water. Then, Dr. Tori, why do we need to talk about pneumonia? Why is pneumonia an important thing for us to be talking to others about?
Because it's one of the commonest causes of under 5 mortality, if not well handled. And if it is picked early and you present to the hospital early and antibiotics are instituted early, you could be able to salvage that child, even if the child has a pneumonia. And so mothers need to know when to recognize signs and symptoms that will make them to get to the hospital on time for the child to be seen and treated. So it's a leading cause of under 5 mortality, and we just have to talk about it.
Okay, thank you. So, Dr. what are those signs and symptoms that the mother should watch out for? When should they go to the hospital? I mean, what are those things that will make them suspect that they may have pneumonia, and what should they do?
Okay, so one of the common symptoms, which may be common to everything, is a common symptom called cough.
Okay.
But it's not every child that is coughing that has a pneumonia. So when you see a child coughing, you want to watch out for some things. Does this child is the breathing fast? So you see a child that is breathing faster than normal. It could be that there is a pneumonia in that lung associated with the cough. You could see a child with shortness of breath. Some older children may complain of chest pain. We could have children who are unable to drink, unable to eat, because the pneumonia is quite severe. Those children must get to the hospital on time. So the main triad is cough, fast or difficulty in breathing, shortness of breath, a fever. A fever, so that's high temperature, could also be a warning sign. So if you have a child with a cough and a fever, you should actually get to the hospital. And if you see any other symptom associated, then the doctors will look more closely and make a diagnosis for this child.
Okay, Dr. Tomi, I'm very happy that you mentioned cough as one of the common symptoms of pneumonia. But what we see is that mothers in Nigeria and most parts of the world, when the child has cough, what they just do is to go and buy cough syrup. And how does that practice affect recognition and the implication for pneumonia here?
Okay, so cough syrup in children, we don't advocate for cough syrup in children.
And hear it
Why?
now.
If a child has pneumonia, what you're doing, the cough itself is a reflex. It's the body system of trying to react to what is going on in the lungs. And so when you have fluid and all that, you actually need that cough reflex to get rid of all those things. Most of the cough syrups suppress these things, and so tends to worsen the process that is going on in the body. So we don't advocate giving cough syrup, except you are really sure that this is not pneumonia. There are instances where we could want to give, but that child must have been examined by a doctor to be sure what is going on. Don't reach for cough syrups at the first sign of cough. You don't know what could be going on in that chest, and when you suppress the cough, like I've said, what you're doing is reversing the body's normal mechanism of trying to cope with such situations.
Okay, so Nigerian mothers and all our viewers, I hope you've heard. So please, when your children have cough, the first thing to do is not to reach for cough syrup. I know many people do it. That is wrong. And if the child actually has pneumonia, you are actually going to delay the presentation of that child to the hospital. And that is one of the reasons why the children actually die from pneumonia. Because if you come to hospital on time, like Dr. Tomi said, fever, cough, difficulty of fast breathing, that triad, you must go to the hospital. That's not the time to give paracetamol and cough syrup. You're actually delaying that child's presentation. Okay, ma. So if a child, for those of you that have questions, I can see your questions. We will take them, but some of the questions we're going to actually answer them. So you can just keep on listening and then you will get the answer to the question. So what is the treatment for pneumonia, Dr. Tomi? So if a child has fever, cough, and fast difficulty breathing, and the mother has come to the hospital, what treatment she should be expecting?
Okay, so when the child presents at the hospital with these symptoms, first is that the doctor is going to do a thorough examination of the child, looking for signs that confirms that this child has pneumonia, and also signs of any complications that could have arisen from the pneumonia. Such complications include anemic heart failure, which may be anemic or not anemic. So the doctor needs to examine, and at times it's these complications that kill faster than the pneumonia. So when the child is examined, the doctor looks for whether this is pneumonia and also looks for signs of the pneumonia. After a thorough examination, we usually run some investigations. Like I've said, pneumonia could be fungal, viral, or bacterial. So we run investigations to try and decide what is causing this pneumonia. A full blood count, what we call CRPs, could be done. A chest X-ray is mandatory in a child that you are suspecting pneumonia. The chest X-ray helps us to look at the condition of the lungs, and it also helps us to see if there are any complications that has arisen as a result of the pneumonia. Then when you do that and you have determined what is causing this pneumonia, then it's time to treat. Treatment actually depends on the severity of the pneumonia at presentation. There are children that you can manage as outpatient basis. There are children that you have to admit in the hospital. And there are children within the that you see in the hospital that you have to take to the unit if it is quite severe. So the treatment depends on how the clinical state of that child when the child presents to you. Now we have said a lot of things. So if you see that this pneumonia is viral, or if it is bacterial, you treat with respective antibiotics or medications that are necessary for it. So for bacterial, definitely that will be antibiotics. For viral, we have some antiviral medications we can give for viral pneumonia, which could come in handy at such times. But the commonest cause is actually bacteria that we see and could lead to a lot of fatalities, that's deaths.
Okay, thank you so much. So I also notice a practice among mothers. So when the children have cough or fever, they've been to the hospital for the first time, and the doctor wrote antibiotics, maybe amoxicillin, maybe any of these common antibiotics, Septrin. Then the next time that child has fever and cough, the mother felt there's no need for me to go to the hospital again. She just goes to the chemist or the pharmacy shop and asks them for that same antibiotic. What do you have to say? Is this a good practice for the mothers, or what do we have to say about that? Dr. Tommy, did you get my question? Okay, it's like Dr. Tommy is hanging. All right, so just keep your questions coming, and then we'll see how we can. So we're still talking about pneumonia, and for those who are just joining us, we'll just try and recap what we have discussed so far. Okay, I think I lost Dr. Tommy there. She will soon join us. So for those who are just joining us this morning, we've been talking about pneumonia, and I've been hosting Dr. Olatomi Bamigboje, consultant pediatrician at Lagoon Hospital. She's also one of our ACP admin and pediatricians as well. And she's been telling us about pneumonia. She's been telling us that pneumonia is infection, and she's told us what we need to watch out for, and especially if the child has fever and cough, and the child also has fast or difficulty with breathing, then those children, you really need to take them to the hospital. You can't just assume. She has demystified to us that that's not the time to reach for your cough syrup, and that's not the time for you to go. So Tommy, welcome back.
Thank you.
I think I lost you. So I was asking that this practice of the fact that maybe my child has pneumonia last week or last month, and the doctor gave me amoxicillin, and then within maybe another 1, 2, 3 months later, the child has fever and cough. So most mothers would just go and grab you would not bother to go to the hospital again. They would just buy the same antibiotics and repeat it. Or even when another child, if I see another child who is having fever and cough, I'll just tell them, don't need to go to the hospital. This is what the doctor gave me. Oh yeah, you to just go and buy it. What do you have to say to that practice, Dr. Tommy?
Well, like I was saying, that is not a good practice. Not just a good practice, it's also a dangerous practice.
Very dangerous.
We have said that not all cough is pneumonia. Not all cough requires antibiotics. So there are clear indications for giving antibiotics when a child is coughing, and that is drug abuse of drugs. Self-medication is not advisable. When a child has cough, someone needs to know what is going on in that chest by doing a good examination of the chest, making a diagnosis, and treating appropriately. So not all cough is pneumonia, not all cough requires antibiotics. And also abusing antibiotics, we are risking the issue of resistance. And so when the antibiotics are actually needed, they do not work. So please don't reach for antibiotics at the earliest sign of a cough. Some cough, when a child is coughing, we have what we call upper respiratory tract infection, which and their irrespective of what you have to them evaluate, let them run appropriate investigations, and then they can decide on what form of treatment that your child needs. Please do not reach for antibiotics on your own.
So you've had it, everyone. Don't reach for antibiotics. All right. So Rita is asking, how do we control pneumonia? I don't know what she means by control. I guess, Rita, do you mean how do we treat pneumonia, or do you mean how do we prevent pneumonia? So anyway, we've answered the question of treatment. So maybe Dr. Tomi should just talk about prevention. How do we prevent pneumonia from happening? Okay, it's like Dr. Tomi is hanging again. All right, so we'll take your question, Rita, when Dr. Tomi is back with us. So again and again, you've had it, the practice of always just reaching for antibiotics when you think your child has cough and you think your child may have pneumonia is a very dangerous practice. It's antibiotic abuse. And in the process, you are not just it is not just about that child. It is about the future of that child, because next time the child now have um has infection and we need to use antibiotics, that child may actually not respond anymore. And that shows that the child is, and that can be dangerous, because when you don't have drugs to treat a particular condition that the child has, then you are really in a dilemma as a doctor. So that's one of the reasons why we've been saying, please and please don't just abuse antibiotics. Okay, thank you so much. We apologize for some of these technical issues we are having, but I hope you are still following us. So Julie is asking for signs and symptoms of pneumonia, because Dr. Tomi has already answered this one before. So I'm just going to recap it. And basically, one of the commonest symptoms is cough. And apart from cough, the child will also have fever, and usually they have fast and difficulty with breathing. So if you have a child who is having fever, who is coughing, who is having difficulty with breathing, that is not a child to give cough syrup. That's not a child to just go and be doing self-medication on. That is a child that you really need to bring to the hospital as soon as you can. So that is basically what the answer to your question is, because we've already answered that. Uma Abbas Udom is asking, can exposure to too much cold cause pneumonia? And Dr. Tomi has answered that cold is not the cause of pneumonia. So it is not the cold that is. Pneumonia is an infection. It is caused by either viruses or bacteria or fungal. Cold can predispose you to what we call hypothermia. In other words, your body temperature is low. And what that means is that your body's ability to respond to situation will be slowed down, because the processes in the body will be slowed down when you are cold. So, and that of course can predispose to so many other things. But strictly speaking, cold is not the cause of pneumonia. I know it's a very common belief system in Nigeria, but cold is not the cause of pneumonia. Another person is asking, are there vaccines necessary for pneumonia? Yes, we actually have vaccines that can prevent certain kind of pneumonia caused by certain kind of organisms. So I really need this to be very clear, because some others will always tell me, but doctor, I've taken the pneumococcal vaccine, which is supposed to prevent against pneumonia. I've taken the Haemophilus influenza vaccine, which is supposed to prevent some pneumonia. But if you remember the beginning and the definition we gave, that pneumonia is caused by many different kind of bacteria, many kind of viruses, many kind of organisms, like even other organisms like fungi, parasites, and things like that are not so common. So when you get the vaccine you're taking is only preventing certain kind of pneumonia. So pneumococcal vaccine will prevent some pneumonia caused by certain species, not even all the streptococcal bacteria that are species that are available. So we have like PCV testing can only prevent against 13 serotypes of that pneumococcal pneumonia. And we also have PP10. That one also brings about 10. So it is not all the bacteria that are covered by your by the vaccine. So there are some bacteria that are not covered. Dr. Tommy, welcome back.
Thank you.
Yeah, so somebody was asking, how do we prevent pneumonia? So I will just go back to that question. So maybe you can address that for us.
So how do we prevent pneumonia? It starts by our way of life.
Yeah.
Smoking around children is a fact. Smoker in the house. They are predisposing the children in that area to pneumonia. That's what the attendant towards children. Definitely children under the age of 5, because their immunity are more prone to pneumonia than other people. We have it usually at the extremes of age. If you have an adult that has such in the home, then that child is also at a risk. Children with chronic lung issues such as asthma, cystic fibrosis, these are conditions that children could have that could make them prone to pneumonia. Children that has underlying heart diseases or other chronic diseases. And then if you had recent trauma, that could also predispose to pneumonia. Children that have recurrent issues with aspiration because they have issues with swallowing, that can also predispose to pneumonia. So how do we prevent pneumonia? Avoid smoking around people, around children. Avoid air pollution in all its forms, including cooking with wood and all that causes smoke that can predispose to air pollution. Yes. Avoid open air burning of dump sites and all. It could predispose to to pneumonia. And most importantly, we have vaccines available for prevention of pneumonia. For the common organisms, H. influenza, for pneumococcal, we have vaccines that are available to prevent this. And so vaccination is a sure way to prevent the common causes of pneumonia in children. Of course, hygiene also is a major factor in prevention of pneumonia.
Okay, thank you so much, Dr. Tommy. So you've had it. I was actually telling just before you came online that all the vaccines we have do not prevent all the possible causes of pneumonia, because sometimes
they do not prevent all.
Exactly, because some mothers have asked me that, but my baby had pneumonia, but we took pneumococcal vaccine, and how come my baby still have pneumonia?
So these vaccines are specific for specific organisms.
Yeah.
So through research and all, what has been done is the common organisms that causes pneumonia, they have developed vaccines for them. Vaccine development is still ongoing. So we may still have additional vaccines in the future, but we don't have vaccines to cover all the types of organisms that cause pneumonia just yet. But we have vaccines that cover the common causes that are associated with high mortality and high morbidity rates.
Okay, thank you. So you've had that, and so somebody is asking, can too much cold cause pneumonia? Dr. Tommy, I know you've answered that before. Do you just want to give one line?
No.
No.
Too much exposure to cold does not cause pneumonia. However, I just want to give a brief that during cold weather, viruses tend to proliferate more. Okay, and so you could have a lot of viral issues, flu and all that coming up during cold weather. But it's not because they are exposed to cold. It's actually because of the organisms that thrive in
Okay. Okay. Just manage with internet today. Okay.
Weather.
Okay. So somebody is asking symptoms of pneumonia, which we have dealt with already. But I think we just want to clarify. She's asking that will all the symptoms be present at a time in a child that has pneumonia? Another one, I think maybe if I can clarify, do you have to wait until you have all the symptoms before you take action? I don't know whether, Christiana, that's what you're trying to ask.
So a child may just have a cough and a fever, depending on the stage at which you noticed it and took the child, and you noticed the child. The first thing could just be the cough with a fever and then fast breathing. So it doesn't mean that you have to wait for my chest that is telling us that something is going on in that chest. So you don't have to wait for all the signs or symptoms to make a diagnosis of pneumonia.
Thank you, Dr. Tommy. This somebody is asking a very important question here. Mayowa Alimi is saying, Alanda X-rays isn't good for children as it kills some body cells and can cause cancer. Okay, so Dr. Tommy, I think your internet is hanging. Maybe you need to refresh. So Mayowa is saying that X-ray isn't good for children. I agree with him completely. It kills some body cells and then cause cancer. What should be done when one is required? Dr. Tommy, are you back?
When an X-ray is required. Okay,
yes.
So health workers will not request for X-rays arbitrarily.
Yes.
We request for X-rays when X-rays are needed. There's what we call benefits and risks. The risk of having cancer from just one exposure to an X-ray, which is usually a controlled exposure to radiation, is not as much as not doing an X-ray to find out what is happening in the chest of a child that has pneumonia. So the benefits outweighs the risk, which is it is a long-term risk and multiple exposure to radiation that will cause that. Not just, we will not request for X-rays just for the fun of it. We request for X-rays because X-rays are needed.
All right, thank you so much. Rukayat Alimi is asking, your question is quite long and quite winded. Let me just show you. So when you ask questions, try and just go straight to the point. You don't need to tell us all the stories and everything. Basically, we can't see anything after your question was posted. But I think the summary is that your child had surgery, your child is having running nose, the cough is gone, but the child is still having running nose and you're worried what to do. But I'm happy that you mentioned the fact that you already seen ENT and doctors, so you are already in care under some particular professionals. So the best thing is to see them and then they will tell you what to do. Because I'm not so sure what your child has, if you are involved with ENT, is actually has to do with pneumonia. Of course, whatever the ENT procedure is they are doing may be associated with risk of your baby having pneumonia may be higher, but that does not necessarily mean your baby, and there's really nothing you're going to do. So don't go and start giving antibiotics unless your doctor prescribe it. Okay, so somebody is just waking up and saying money, maybe what causes pneumonia and what to do when the child has it. So additional, we've answered your question. So some of you that are just joining. Okay, so Chinaza is asking, how do we differentiate a cough from pneumonia and other coughs? The truth of the matter is that at your level as a mother, it may be so hard for you to do that. So that's why we say, if a child has cough alone, you may just watch. because it may just be viral, it may just be an upper respiratory tract infection. But a child who has cough, who is also having difficulty with breathing, who is also having fast and breathing, usually at that point you really need to take the child to the hospital. A child with cough, with fast breathing, with difficulty with breathing, with fever, those are the signs that are pushing you towards this is not just ordinary cough, this is pneumonia. And if the cough is also going on for too long, so you really need to take the child to the hospital. So okay, Dr. Tomi is back. So that's the I hope that answers your question because she has addressed it before. Okay, somebody is asking, is pneumonia and bronchitis the same, Dr. Tomi? Is pneumonia and bronchitis the same? Okay, it's like I'm really having a lot of challenges connecting with Dr. Tomi. Okay. Okay, I'll continue. So bronchitis and pneumonia is not the same. Bronchitis is usually something that has to do with the airway itself. There's a part of the airway we call.
No.
Hello, are you with me? Okay. Dr. Tomi, we can't hear you. Maybe you refresh. Bronchitis and has to do with inflammation in the bronchioles, whereas pneumonia has to do with the lung tissue itself. So if you watch at the beginning, Dr. Tomi actually defined what pneumonia is. So we are talking about inflammation and infections at a different level in the airway. So initially bronchitis is not common in children. It's something that tends to happen more in adults. Okay. We'll just take on answering your question. Obanishe is saying, if a child has cough when lying down, mostly in the night, is he associated with any respiratory infection? So cough that tends to happen mostly at night is usually not pneumonia. Usually we tend to get that in some conditions, the one of which is bronchial asthma. Another thing is some children have what we call postnasal drip. In other words, they tend to drip down part of the there's a way the airway is looking that makes it they tend to have lots of secretions, and these secretions when they are sleeping tend to go down the back of the airway and kind of cause some irritation there, and they begin to cough. And so if your child has this kind of symptoms, you really need to see a doctor because the child really needs to be examined properly and then the child could be treated. But that is not pneumonia. Of course, some conditions like that can predispose to pneumonia, or pneumonia can actually, like a child who is asthmatic can have pneumonia, and pneumonia can trigger off an asthmatic attack in that particular age. Okay, I'm trying to see whether I can get Dr. Tomi back. Okay, Dr. Tomi is trying to connect with us. Okay, so I think Omon Green is asking, what are the... Okay, Dr. Tomi, are you back? Hello? Hello? Dr. Tomi, are you back with us? Yeah.
Oh,
Okay, yeah. Okay, you're welcome back. I think we have lots of internet connection issues. Okay, so what's the difference between asthma and pneumonia? Somebody is asking. Hello, we can hear you. So what's the difference between asthma and pneumonia?
Actually, and it has to do with inflammation of the airways, not an acute illness once treated asthma is that is recurrent. So things, yes, they might have an overlap of symptoms called asthma affects the small airways in the lungs, while pneumonia is as a result of an infection leading to pus and fluid collection in the lungs. Asthma means that the airways are closing and not allowing the normal flow of air to pass. So asthma is a chronic problem which could be recurrent. Pneumonia is an acute problem. Yes, could also be recurrent, but when I treat an episode of pneumonia, I have treated it. Unlike asthma, that the child may have acute episodes and in between also be having symptoms. So there are two different things.
Okay. Thank you, Dr. Tommy. And you were trying to answer this question before we went out. Bronchitis and pneumonia.
I was saying that pneumonia affects the lungs. Okay. Bronchitis affects the airways, at least that's the pipes in the lungs. While pneumonia is affecting the lung tissue in itself, the alveoli, the sacs in the lungs that are responsible for exchange. So they are both parts of the airways. They are both parts of the respiratory system, but they are different parts of the respiratory system.
All right, thank you. Well, this is not pneumonia related, but I think it's important that we answer it. So this mom is asking whether anti-malaria drug is safe for a breastfeeding mother.
Anti-malaria drug is safe for a breastfeeding mother, yes. However, even as a breastfeeding mother, when you want to use any of the anti-malaria, you could reconfirm from your doctor which you should use, depending on the age of your baby or whatever may be happening in your baby. So there are some medications that, because of circumstances in the baby, will say you should not use. So please see your doctor who will advise you on which is. You have made a blanket question. Anti-malaria, I will say yes, but please see a doctor to give you the exact anti-malaria to use for.
Okay. I think some people are just joining us. They are latecomers to the show, and they want to ask again, what are the symptoms of pneumonia and all that? So, Dr. Tommy, can you just recap for us just recap in summary pneumonia causes, symptoms, and what we need to do when we suspect that a child has pneumonia?
We've said of pneumonia lungs, all of the lungs that bone lungs, said that this is caused by bacteria, viruses. The earliest symptoms include cough, the fever, fast or difficulty in breathing, and at times you have a child that is just unable to severe, that one should go to the hospital and let a doctor examine the child. Examination is to show whether this is really pneumonia and also to identify any complication as a result of pneumonia. We have said treatment depends on the clinical severity of the pneumonia. So you could have outpatient treatment, you said having to have the child in the intensive care unit. The home environment, avoiding indoor pollution, outdoor, avoiding cigarette, use of fossils, burning would also about the importance of immunization of pneumonia. Having said that, we also label those all forms of pneumonia. And we have said that you should not self-medicate when a child, you get that child to the hospital. Not all coughs are pneumonia. Not all coughs need antibiotics. I think that's mainly the things we have spoken about.
Okay, thank you, Dr. Tommy. And I'm so happy that you have been able to tell us the various symptoms and what to watch out for, and all that, which is quite very, very important for us. Thank you so much. I just want to let you know that we're still on live with Dr. Tomi. And if you have questions, please join us now. We still have about 15 more minutes to go in the show. And we've been talking about pneumonia, which is a very important topic to have. We just celebrated the World Pneumonia Day. Pneumonia is one of the killers of our children, and it is important that we talk about pneumonia. So if you still have your questions, don't miss this opportunity and let Dr. Tomi answer the question. So Echikoya team is asking, how will you know when you should take your child to the hospital? A child who is having difficulty in breathing when sleeping. I know that you've answered that question several times, but because I think this is the most important thing for us, because as mothers, we don't expect you to be able to treat pneumonia by yourself. So knowing when to see the doctor is very, very important. That's the essence of having this live broadcast. So Dr. Tomi, what do you tell Echikoya?
Okay, when to take the child to the hospital?
Yes.
You have a child that is coughing, and you have a child that has a fever, or you have a child that is coughing and you notice that the breathing is unduly fast. Please get to the hospital. Don't self-medicate. We have talked about the dangers of using cough syrup when you have pneumonia. So since as a mother you cannot examine the chest of your child by yourself, when your child is coughing and this cough is lingering and your child is having any other associated symptoms, please do get to see a doctor.
Okay. So basically, the fact that your child has difficulty in breathing is an hospital. It's not
It's
something.
an hospital thing.
Exactly.
You can't. That child may need oxygen.
Yeah.
That child may need so many things. So you shouldn't keep a child with difficulty breathing at home for any reason. If the child is just coughing, you may want to observe the child and say, okay, maybe it's the viral cough that will just go and linger. But once you're having other associated symptoms, please just get to the hospital.
Exactly. So I hope we are all clear on this, because I think that's the most important thing. All right. Thank you so much, Dr. Tomi. And the same Naomi is asking, a child of 4 that snores and wake up while sleeping at night, find it difficult to breathe. What could that be?
Oh, I'm thinking of an obstructive sleep apnea. That's what comes to mind.
Yes.
From an adenotonsillar enlargement of the tonsils or adenoids. So she should get the child to the hospital, because that's an enlargement that is causing symptoms. And if the obstructive sleep apnea means that during sleep, the child is having some airway obstruction. And what happens is that if the adenoids are enlarged, when the child sleeps, most of us when we sleep, our tongue falls back. So the tongue falling back further obstructs the already compromised airways and blocks it out completely. You will see that for now, before you see a doctor, if you change the position of the child, and if surgery needs to be done, it will be done. If a medical management can still be attempted, that will be done. But that's what comes to mind.
Yes, I agree with you, Dr. Tomi. And somebody else is also asking, Olatomi say, I want to know about adenoid and whether those symptoms in adenoid are related to pneumonia and asthma.
Okay, adenoids, pneumonia, and asthma.
Yes.
All related to the airways.
Yes.
Adenoids is in the upper airway, and pneumonia has to do with the lungs. I've made a differentiation between asthma and pneumonia. Adenoids doesn't necessarily have to be infective. So you could have an enlarged adenoid that is not infected, and you could have an adenoid that is infected. Pneumonia is definitely an infection. Asthma is as a result of airway hyperreactivity. So the airway closes, and I've said that is chronic. Now, you could have the combination of an adenoidal infection and a pneumonia, because they are all in the airway, and you could have an upper respiratory tract infection progressing into a pneumonia because the organisms that causes infections around that area are similar. When it comes to enlargement of the adenoids, part of the things that causes adenoidal enlargement includes allergy reactions. So the cells there multiply and it becomes big. If you have that background history of allergy when it comes to asthma, so you could have a child that is asthmatic having an adenoid, but there are different diagnoses and they could coexist. They could exist without the other being there, and they could coexist in the same child. So it's not, they are not the same, but they could come together because some of them have the same pathology. But like I've said, pneumonia is purely an infective process. Adenoids could be enlarged because of an infective process, or it could be just a chronic enlargement in the child.
Yeah, I think, Dr. Toby, what I just want to add to the fact that to the mothers, they can all present alike. To a mother, it's either the child is snoring, is coughing, is having difficulty with breath. So it is not for you to know whether it's asthma or adenoid or pneumonia. You have to see your doctor first. It is the doctors that will now tell you they think or is that. And like Dr. Tomi said, it's
for you to go to the hospital.
For a child to have all three, it's not impossible, but it's a bit an unusual child, but it's possible actually because like Dr. Tomi said, they are all at different level of the airway, so of the respiratory system rather, and they can also present to you similar. But obviously you are really confused. Don't try to self-diagnose.
Make a diagnosis yourself.
Don't do that. Don't just rely on, because Dr. Tomi said fever, cough, and my child is pneumonia, or because she has self difficulty in breathing, is that enough? You will confuse yourself. Just take the child to the hospital and let the professionals do their job to tell you what it is. Thank you so much for joining us. We are rounding up. Mary is asking, can a child suffer from pneumonia when he sleeps every day with fan on? Okay, with fan on. Okay.
No.
This is people that believe that fan, AC, and all that cause pneumonia. So she's asking, so Dr. Tomi, what do you say to that?
No, a child does not suffer from pneumonia when he sleeps every day with fan on. However, we have talked, because we've extended this discussion to the spectrum of asthma and allergy. If your child keeps coughing every time the fan is on, you get that child evaluated. It may not be pneumonia, it could just be an allergic process or a symptom of asthma that the child has. So get that child evaluated, but it's not pneumonia. Pneumonia is infective. It is an infection. It is not caused by just cold or fan or anything. It's an infection. And because it's an infection, okay?
All right, thank you, Dr. Tomi. Okay, I've answered that. Okay, Christina, obviously she has asked us so many questions. She's happy. Say thank you, doctor. I hope you do the right thing, Christina. You really need to take that child to the hospital. Thank you. Somebody is also saying, can a child have recurrent bronchopneumonia? What are the causes of noisy breathing? Okay, Dr. Tomi, I think we are beginning to see a pattern here. A lot of mothers are having issues confusing pneumonia, adenoid, and asthma. I think I'm beginning to get a lot of, we are beginning to see the pattern. So what do you have to say? Anyway, can the child have recurrent pneumonia?
Can a child have recurrent pneumonia? Yes, a child can have recurrent pneumonia when they have predisposing factors that persist. So a child that is malnourished, that's one of the risk factors actually for pneumonia. A child who is malnourished, if you don't get that child out of malnutrition, the child can continue to have recurrent episodes of pneumonia. A child who is immunocompromised for anything, HIV, AIDS, immunocompromised from other chronic illnesses, can have recurrent pneumonia. A child with an underlying cardiac issue can have recurrent pneumonia. So anything that compromises the immunity of the child. Now, this person also says, what are the causes of noisy breathing in a child that has been diagnosed with adenoids? I've explained that adenoids comes with noisy breathing. It's because the adenoids are obstructing the airway. So the child's breathing is noisy, the child's breathing is not quiet. So that's what is the adenoids that is actually causing the noisy breathing. It's a symptom of the adenoids. Okay, so that's what's causing the noisy breathing. Noisy breathing is a symptom of adenoidal hypertrophy. So when the adenoids are big, the child will have noisy breathing.
All right, thank you, Dr. Tommy. I think that's very explanatory. Oh, I don't know. Funke saying the child always coughs. I think you are just joining us, Funke. Please watch from the beginning at the end. There are many causes of cough, so you really need to see a doctor to know the specific cause of cough in your own child. So we're getting to the end of the show. Uh, Okay, yes. So, Christiana is accusing doctors. He said that not all cough needs antibiotics, but most hospitals will end up giving you antibiotics at the slightest diagnosis. How can we deal with it? Because they are experts. So, Dr. Tommy, it's up to you to defend your
Okay. To defend my constituency.
Yes.
Okay.
So.
I think it's a mix between what the patient had always wanted, what some doctors have imbibed, and what is right. So in the same vein, we have patients that if they don't get out of that hospital without antibiotics, they will not let the doctor rest. We also have doctors who feel, let me give this patient antibiotics, it will cure everything. No, you have a right to patient education. The doctors have a right to educate their patients. When there is patient education, there are many patients that will get back. I've had a child that had a cough for almost 4 weeks. We didn't use any antibiotics, and the cough went after some time. It wasn't an allergy, it wasn't anything, but we just gave antihistamine to try and help the child to calm down. And the child was okay. So it's not the length of the cough that makes it pneumonia. It's not the duration of the cough. It's not the intensity of the cough that makes it pneumonia. It is what you have examined when you check the chest and you do your lab investigations. So what I will encourage is that do ask your doctors questions. Let them know. And if you have the slightest inkling that they are not convinced about it in this case, please let them know that you will choose to go without the antibiotics in this case. But they tell you that antibiotics is really required in this case, then you can go ahead. If you are in doubt, please get a second opinion. That's what my advice will be also.
Exactly. And I think one of the things that we have succeeded in doing on ATP is turning the mothers into serious, serious patients that when they go to the hospital, they ask doctors questions and they force their doctors to answer them. Like Dr. Tommy said, it's your right to ask questions. Your doctors must justify to you why it's giving the antibiotics. So you should be able to tell you, okay, I've done this blood test, I've seen this, or maybe when I did the examination, these are the things. But if those things are not there, no fever, none of those things, then and of course, once you also go to the hospital, we are assuming that you there's something more serious, but then don't just say whatever. You must ask questions. And if, like Dr. Tommy said, if you are not convinced, seek second opinion, and that should help you. But we're not saying don't listen to your doctors, so please. All right, I think we've answered Rashida, when we finish in another 5 minutes, you can watch this video all over again. You will see all the symptoms, the treatments, and the prevention of pneumonia. Okay, we've answered. Gladys asked a question. You said I want to ask, but we didn't see any question. So you have 3 more minutes to ask your question. Okay. Final question. My daughter had an tonsillectomy surgery 2 months ago, and she has been having recurrent cough and catarrh despite several treatments with antibiotics. And I noticed she has been snoring at night again. Pora, I think it's better you go back to your ENT surgeon for a follow-up. If your child had had a surgery and is still having lots of symptoms, the most logical thing to do is to go back to those doctors who know your child very well, who did the surgery, who knew everything. They would definitely know what to do. Okay, Gladys is saying, okay, my son has not been eating properly. Okay, Gladys, I think this question, you will just go to our Facebook group and ask it there. If you go to Facebook, just type Ask the Pediatrician, you will land in our group. We'll be able to answer your question longer. Today, we just want to focus on pneumonia, but your question is very important, but we will be able to answer it better on the group. We even have a lot of unit courses or video on feeding, nutrition stuff that will really be very helpful. All right, Naomi is saying thank you so much. We act accordingly. We are happy you're going to do that. I'm just joining now. Okay, you just have to watch the video all over again. And we want to ask about the symptoms of adenoid because we are not dealing with adenoids today, but Dr. Tomi has already actually did a beautiful comparison of what is adenoid, what is pneumonia, what is asthma. So Okolo, just watch the video all over again so that you can get it. And Adaku is saying, okay, noisy breathing when exposed to the cold and hair. I think you really need to go see your doctor to be sure what it is in your own baby. Somebody is saying I have a child who has been treated with cough and cough syrup and Levixime. I think that's an antibiotics, but she's still having cough for like yeah. I think you really need to take your child to see you need to go back to the hospital for a follow-up. All right. Okay. I think we are almost
see a pediatrician
to the end. Sorry. All right, we're done. We're done. Okay, so Dr. Tomi, what's your take-home message?
Okay, my take-home message is pneumonia is still sovereignty. Early presentation will limit the complications of the disease and deaths arising from this. So we just want to implore our mothers, please, if you notice any sign of pneumonia in your child or any symptom of pneumonia in your child, do present at the hospital. Don't try to self-medicate. Let the doctors examine your child and let them treat appropriately. And we have elder children and we have children who, even if they develop pneumonia, will not have the severe forms of pneumonia that we have to deal with. And also, the take-home is get your child immunized. Let's prevent what we can prevent, and then we are left to deal with what needs to be dealt with. Thank you.
Thank you so much, Dr. Tomi. I'm very, very excited that you were able to join us this morning. We had quite a few challenges, but we were able to make it through to the end. Thank you so much. I'm sure our mothers, our viewers, they have learned quite a lot from you this morning. We really want to say thank you so much. I know you're a very busy executive, so for you to be hospital executive for that matter. So for you to just give us 1 hour of your time today, we are very, very grateful. Thank you so much, and we pray God to continue to bless you and to renew your strength. Amen. Thank you so much.
Amen.
Okay, so back to the end of the program. I can see some people are still dropping questions. Unfortunately, we will not be able to take those questions, but that does not mean you can't still ask your questions. So if you still have questions, please do not drop it anymore under the video. You have to go to our Facebook group. Once you get to Facebook, look for, just type in Ask the Pediatricians. You will see a group that comes up. Join the group and drop your question. Or if you're a member of the group already, post your questions directly on the group, and we have our moderators, our professionals that we attend to them. If you've missed some part of the video is going to be available shortly after we have finished, and you can watch it again on our watch party. We also put it on our YouTube channel, which you can watch it. If you want to watch all our previous videos as well, you can watch it on our YouTube channel. And if you are a corporate body, organization, or an individual who is interested in sponsoring our program, we welcome you very much. So just get in touch with us. You can send us an email on askthepediatricians@gmail.com or ask@askthepediatricians.com, and we'll be able to tell you how you can participate in our program, and we'll really like you. So for everyone that joined us this morning, this program has been brought to you courtesy of Ask the Pediatricians Foundation. We're an NGO that is committed to the well-being of all children, especially those in Nigeria and in indigent communities. So we really would like you to be part of us. You can join our group. You can support our outreaches. You can be part of us in many ways. And if you reach out to us, we'll tell you how you can be part of it. So once again, I want to thank Dr. Tomi for joining me this morning on ATP Live. And it's nice to have another It's nice to have another pediatrician in the house. And so, as this other bonus is only me that's saying it, at least you've heard from another person this morning. So, thank you so much and have a wonderful weekend, everyone. Bye.
Same to you. Bye bye.